Hello everyone, I am Sandra May Ibrunyola from BSN 212E of Double Doctors College, and today I'm going to perform the cardiopulmonary resuscitation, or also known as the CPR. It is an action which it compresses the chest and gives breaths that will help keep the oxygen and blood flowing throughout the body of the patient whose heart has stopped breathing. So now what I'm going to do first is the newborn resuscitation. If you find an unresponsive newborn, quickly check for the responsiveness by tapping the shoulder or rubbing the soles of the feet, or by calling the baby out. Baby, baby, are you okay? Baby, baby, are you okay? So after doing that, if there's still no response, we have to call out for code blue and doctor's order. Code blue, doctor, quick! So that the doctor and the nurses will have to come over to help revive the newborn. So what we're going to do is to check and open the airway of the patient by checking the breathing for 10 seconds by using the look, listen, and feel method. So check to see if the chest is rising or falling, and listen over the mouth and nose of the breathing sound, and feel their breath against the cheeks for 10 seconds. Okay, so we can also suction the baby's nose and mouth by using the suction valve to remove secretions if there's any, especially if it's causing obstruction in the airway. Okay, so if there's still no response, then we need to give rescue breaths by using this alternative pediatric valve bag mask. What we're going to do is to place it over the patient's nose and mouth, ensure to cover it, and hold the rim of the valve mask by using the forefingers and the thumb to ensure pressure seal. Breathe, 2, 3, breathe, 2, 3. So after that, have someone to connect the cardiac monitor and the pulse oximeter to monitor the progress. So as if it was connected already. Then if there's still no signs of life, no circulation, then we need to proceed to the CPR immediately. So what we're going to do is to place 2 fingers at the center of the breastbone below the nipple line and compress for 1.5 in depth for 30 times. So place your one hand over the foreheads of the newborn to keep the airway open. So count out loud. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then give 2 rescue breaths. 1, 2, 3, breathe, 2, 3. Then continue to give CPR until we reach 4 cycles or until we see signs of life. So we already have done the 1 cycle and we have 3 more. So count out loud. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Breathe, 2, 3, breathe, 2, 3, breathe, 2, 3. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Breathe, 2, 3, breathe, 2, 3. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Breathe, 2, 3, breathe, 2, 3. Okay, now thankfully that our patient has been revived with 136 beats per minute according to our cardiac monitor here. And after that, if the patient is already in a designated room, remember to maintain a target temperature for at least a value of 32 to 36 degrees Celsius for 24 hours. And of course, to monitor the vital signs, especially the oxygen saturation for the passage airway as part of the post-resuscitation care. So don't forget to document the time, the procedure, the assessment, and the response of the CPR. Okay. Hello everyone. Today I'm going to perform the adult cardiopulmonary resuscitation and perform the AED skill. So first things to do is to do the assessment and the activation. So now that I have arrived at the scene, I am going to quickly scan the area to check for the environment. If there's a hazard present, it may be in a form of fire, falling debris, or chemical substances that could just potentially harm us and the patient. So if a hazard is present and if we might do get injured, then we can be able to fully assist and help the patient. So after ensuring that the area is safe, I am going to check for my patient's level of consciousness by tapping the shoulder and asking if he's okay. Sir, can you hear me? Sir, are you okay? Sir! After doing that, if there still has no response, then I'm going to call or I'm going to activate the emergency response through the standard of calling the 911. You, ma'am, in white shirt, please call the 911. We have a patient in need of immediate help. Hurry! So, after that, I am going to check for my patient's airway. If the patient is wearing a constrictive clothing, then we have to loosen it up first. Or we can do the head lift or chin lift. Then I'm going to check for his breathing and pulse. 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. So since my patient has low still response and no circulation or no signs of life, then I'm going to give or to proceed to the cardiopulmonary resuscitation. So CPR is a useful technique a useful technique in emergency situation, especially in the heart attack and near drowning, for it will help or it reduces the number of lives of the patient whose heart or breathing has stopped. So to give a quality care of CPR, first we need to locate the chest area and then place one hand, heel of one hand at the center of the breastbone just below the nipple line. Okay? Then, and on top of the one hand is the other hand that will interlock the other hand. So, we're going to lean on the patient to deliver the quality and in-depth compression of 2 inches. Then give 30 compressions and 2 rescue breaths after. Then count out loud. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then give 2 rescue breaths by using this bag mask by covering the patient's mouth and nose. Then after that, we continue to give CPR until the AED arrives or the another rescuer will take over. So we're going to do 2 cycles more. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So now that the AED arrived and the another rescuer will take over, then, so as if I am the second rescuer and I'm going to perform the AED skill. So first, what I'm going to do is to quickly scan the patient's chest area if it's hairy, for the hair will act as a barrier for the shock of the AED will deliver. Then turn on the AED. And patches at the right position. One is going to the chest, below the clavicle, so here. And one is placed just beneath the armpit of the patient, just below the nipple line. Okay? So that's it. We have placed the patches. Then so since our AED is already turned on, we'll wait for the AED to analyze the heartbeat. Then if it was already analyzed, then we can do this. Everybody clear? Delivery shock in 3, 2, 1. Shock delivered. Then continue giving CPR of 5 cycles and 2 rescue breaths per cycle, and switch it over for AED again if there's still no signs of pulse or breathing. Then until the AED will tell us to stop, or until the patient have already been revived. Okay. So now let's proceed to pediatric resuscitation. So it involves a child or an infant who need immediate resuscitation. So basically, by doing this procedure, it is somehow similar to the adult CPR, but the only difference is that the number of hands or fingers used in a chest compression. So to begin with the procedure, I'm going to check for the environment to ensure that the scene is safe. Then next, check for the patient's level of consciousness. If the patient is not breathing, then I'm going to activate the emergency response system. Baby, can you hear me? Baby, can you hear me? Ma'am, you in white shirt, please call 911. We have a patient in need of help. Hurry! After doing that, I am going to check for the patient's ABC, the airway, the breathing, and the circulation. So first, we're going to open the patient's airway. If ever the patient is wearing a constrictive clothing, we need to loosen it up. Or we can just do the chin lift or head lift. Then after that, I'm going to check for the patient's breathing by using the look, listen, and feel method. So look to see the rise, if the chest is rising or falling, and listen over the patient's mouth and nose if there's breathing sound, and feel for their breath against the cheek for 10 seconds. Okay, so the baby is, or the child is not responding. I'm going to give 2 rescue breaths by covering the mouth with a mask. After that, I'm going to check for the pulse and the breathing. So the baby is still not responding. I am going to proceed immediately to the cardiopulmonary resuscitation. So what I'm going to do is to place my 2 fingers, the fingers in the breastbone just below the nipple line. So as if this is our breastbone. Then I'm going to compress or to do compression at a 1.5 inches in depth for 30 times. Then give 2 cycles per each cycle. So count out loud. Remember to hold the baby's forehead or head to maintain an open airway. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then continue to give CPR until we reach another 4 cycles or until rescuer arrives to take over. So make sure that upon doing the chest compression, there should be a complete chest recoil, and in giving rescue breaths, there should be a chest rise. So another 4 cycle. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, so if it's a child in a age range of 1 to 8 years old, then we can do the chest compression by placing the heel of one hand just below the breastbone and give 30 compressions and 2 rescue breaths again for per cycle. So in this time, we need to do the 5 cycles. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Last cycle. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then check for after 1 minute of giving CPR, then check for the breathing and pulse. Okay, so now put the patient in a recovery position and document the findings, the assessment, the time of the assessment have begun and how the time ended.